The importance of blood pressure control. Blood pressure, a key indicator of health. Blood pressure is one of the most crucial indicators for assessing a person's health. Maintaining stable blood pressure not only ensures normal bodily functions, but also prevents severe complications. However, many people neglect regular blood pressure monitoring, leading to late detection of health issues and delayed treatment. How does blood pressure affect health? Blood pressure reflects the force exerted by blood on the artery walls as the heart pumps blood throughout the body. When high blood pressure persists for a long time, the heart has to work harder, increasing the risk of heart failure, stroke, and other cardiovascular diseases. Additionally, high blood pressure can negatively impact the kidneys, eyes, and nervous system, raising the risk of chronic kidney disease and vision impairment. Not only high blood pressure, but also low blood pressure is a concern. When blood pressure drops too low, the body does not receive enough oxygen and nutrients, leading to dizziness, fainting, and even circulatory shock if not treated promptly. Why should you monitor your blood pressure regularly? Many people suffer from hypertension without noticeable symptoms, making them unaware of the condition until complications arise. Regular blood pressure checks help detect abnormalities early, allowing timely intervention. If blood pressure is too high or too low, doctors can provide appropriate treatment, including lifestyle adjustments and medication to maintain healthy levels. Blood pressure monitoring is especially crucial for older adults, individuals with a history of cardiovascular disease, diabetes, or those experiencing high stress and overwork. These groups are at a higher risk of developing hypertension and related complications. How to effectively control blood pressure. To maintain stable blood pressure, adopting a healthy lifestyle is essential. Follow a balanced diet, reduce salt, sugar, and saturated fats, while increasing intake of vegetables, fruits, and potassium-rich foods. Exercise regularly. Activities such as walking, yoga, and swimming improve circulation and help regulate blood pressure. Manage stress. Practice relaxation techniques, get enough sleep, and avoid excessive workload. Avoid smoking and limit alcohol consumption. These factors contribute to high blood pressure and cardiovascular diseases. Monitor blood pressure regularly. If possible, check blood pressure at home or visit a medical facility for accurate assessment. By maintaining a healthy lifestyle and monitoring blood pressure frequently, you can protect your heart and overall well-being. Understanding hypertension, risks, and management. Hypertension, also known as high blood pressure, is a common condition that can lead to serious health complications if not properly controlled. It occurs when the force of blood against the artery walls remains higher than normal over time, increasing the risk of damage to the heart, brain, kidneys, and other organs. What is a normal blood pressure reading? Blood pressure is measured using two values. Systolic pressure, the pressure in the arteries when the heart pumps blood. Diastolic pressure, the pressure in the arteries when the heart rests between beats. According to the American Heart Association AHA, blood pressure is classified as follows. Normal blood pressure, below 120/80 mmHg. Prehypertension, between 120-139/80-89 mmHg. This stage is a warning sign, indicating an increased risk of developing hypertension if preventive measures are not taken. High blood pressure, hypertension 140/90 mmHg or higher. Causes of hypertension. Hypertension can be caused by various factors, including genetics. If there's a family history of hypertension, the risk of developing it is higher. Unhealthy lifestyle, excessive salt and saturated fat intake, lack of physical activity, smoking, and excessive alcohol consumption. Underlying medical conditions. Kidney disease, diabetes, and hormonal disorders can contribute to high blood pressure. Chronic stress. Prolonged stress can temporarily raise blood pressure and may lead to chronic hypertension if not managed properly. How to control hypertension. Managing blood pressure is essential to preventing serious complications. Some effective strategies include maintaining a healthy diet, reduce salt intake, limit processed foods, and increase the consumption of fruits, vegetables, and potassium-rich foods. Regular physical activity. Engaging in at least 30 minutes of exercise daily helps improve circulation and lower blood pressure. Weight management. Excess weight increases the risk of hypertension. Maintaining a healthy weight is crucial. Stress reduction, meditation, yoga, or other relaxation techniques can help stabilize blood pressure levels. Routine blood pressure checks. Regular monitoring allows for early detection and timely intervention. If you have risk factors or your blood pressure is above the safe threshold, consult a doctor for proper guidance and treatment. Controlling hypertension not only protects heart health, but also enhances overall well-being and quality of life. Hypertension is one of the most common and dangerous cardiovascular diseases, affecting people of all ages. According to the World Health Organization, WHO, and global cardiology associations, hypertension is classified into 3 different levels, ranging from mild to severe. Accurately identifying the severity of the condition helps patients adopt appropriate management and treatment strategies, reducing the risk of severe complications such as stroke, heart failure, or kidney failure. 1. Classification of hypertension levels. Hypertension is generally classified into 3 levels based on blood pressure measurements. Grade 1 hypertension, mild systolic blood pressure between 140 to 159 millimeters of mercury, and or diastolic blood pressure between 90 to 99 millimeters of mercury. At this stage, symptoms are often unclear, but if left uncontrolled, the condition may progress to a more severe level. Grade 2 hypertension, moderate systolic blood pressure between 160 to 179 millimeters of mercury, and or diastolic blood pressure between 100 to 109 millimeters of mercury. Patients may experience symptoms such as headaches, dizziness, and blurred vision. Grade 3 hypertension, severe systolic blood pressure greater than or equal to 180 millimeters of mercury, and or diastolic blood pressure greater than or equal to 110 millimeters of mercury. This is a dangerous stage that can lead to serious complications if not treated promptly. 2. Hypertension can occur at any age. Many people assume that hypertension only affects older adults. However, in reality, it can occur at any age, including newborns. Some children develop hypertension due to congenital heart conditions, particularly coarctation of the aorta. In these cases, failure to detect and treat the condition early may result in severe complications. 3. Secondary hypertension in young individuals. In individuals under 35, hypertension is often linked to secondary causes such as renal artery stenosis. Narrowing of the renal arteries reduces blood flow to the kidneys, triggering mechanisms that increase blood pressure to compensate. Chronic kidney disease. The kidneys play a vital role in regulating blood pressure. When they are damaged, this function becomes impaired, leading to hypertension. Endocrine disorders. Conditions such as hyperaldosteronism, Cushing's syndrome, or pheochromocytoma can cause secondary hypertension. Regular blood pressure monitoring is crucial for early detection of hypertension-related issues. If risk factors are present or abnormal symptoms occur, individuals should seek medical attention for timely diagnosis and consultation. Causes and risk factors of hypertension. Hypertension is a common condition that can lead to serious complications such as stroke, heart failure, and kidney disease. Below are the main causes and risk factors of hypertension. Genetics and age. Genetic factors play a significant role in the risk of developing hypertension. If you have a family history of high blood pressure, your chances of developing the condition are higher. Additionally, as you age, blood vessels lose their elasticity, making it easier for blood pressure to rise compared to younger individuals. Unhealthy lifestyle. An unhealthy lifestyle is one of the leading causes of hypertension. Poor diet, consuming excessive amounts of salt, saturated fats, and processed foods increases the risk of high blood pressure. Lack of physical activity. A sedentary lifestyle reduces the body's ability to regulate blood pressure, increases the risk of obesity, and negatively affects cardiovascular health. Chronic stress. Prolonged stress, work pressure, and anxiety trigger the release of hormones that constrict blood vessels, leading to increased blood pressure. Use of stimulants. Alcohol and tobacco can damage blood vessels, increasing the risk of hypertension. Underlying medical conditions. Certain medical conditions can contribute to high blood pressure, including chronic kidney disease. When the kidneys fail to effectively remove sodium and water, pressure in the blood vessels rises. Hormonal disorders, conditions such as hyperthyroidism, Cushing's syndrome, and pheochromocytoma can cause blood pressure imbalances. Prevention and management. To prevent hypertension, it is essential to manage risk factors by maintaining a healthy lifestyle, undergoing regular health checkups, and following prescribed treatments for any underlying medical conditions. White coat hypertension, a phenomenon not to be overlooked. Have you ever had a normal blood pressure reading at home, but when measured at hospital, the number suddenly spiked? This could be a sign of white coat hypertension, a common but often misunderstood phenomenon. What is white coat hypertension? This condition occurs when blood pressure readings are elevated in a medical setting but remain stable when measured at home. The primary cause is anxiety or stress when encountering doctors or medical staff. This triggers the release of adrenaline, leading to temporary vasoconstriction and an increase in blood pressure. Potential risks. Although it is not always a sign of an underlying condition, white coat hypertension can cause unnecessary worry and anxiety. On the other hand, some individuals with actual hypertension may be overlooked because their blood pressure readings appear normal at home. Without proper monitoring, the risk of cardiovascular, brain, and kidney damage remains. How to diagnose and monitor it? To obtain an accurate diagnosis, patients should use a 24-hour ambulatory blood pressure monitor, ABPM. This device records blood pressure throughout the day, including during work, rest, and sleep. Based on this data, doctors can assess the actual condition and determine whether treatment is necessary. Recommendations. If you experience white coat hypertension, it is important to regularly monitor your blood pressure at home. Stay calm while measuring, and consult a doctor for appropriate guidance. How to diagnose and monitor blood pressure effectively. Blood pressure is an important indicator reflecting cardiovascular health. Proper diagnosis and monitoring help detect hypertension risks early and take timely control measures. Let's explore the most effective methods for measuring and tracking blood pressure. Measure blood pressure multiple times a day. Blood pressure is not constant. It changes with activity, mood, and time of day. To get accurate results, you should measure blood pressure at least 2 to 3 times a day, morning, noon, evening. Rest for 5 to 10 minutes before measuring. Sit in the correct posture. Keep your arm at heart level, and use a standard monitor. Avoid measuring immediately after intense exercise, caffeine consumption, or stressful situations. Use 24-hour blood pressure monitoring. The 24-hour blood pressure monitoring method, ambulatory blood pressure monitoring, is the best way to track blood pressure throughout the day. It helps doctors assess blood pressure patterns and detect abnormal fluctuations. This method has several advantages. Provides an accurate measurement of actual blood pressure, avoiding errors due to anxiety during clinical visits. Monitors blood pressure during sleep, work, and daily activities. Helps doctors develop an appropriate treatment plan. If you have risk factors or abnormal blood pressure symptoms, regular monitoring and timely medical consultations are essential for cardiovascular health. Managing hypertension. Understanding for effective control. Hypertension is a common condition that can lead to serious complications if not properly controlled. Treatment depends on the underlying cause and falls into 2 main categories: primary hypertension and secondary hypertension. Primary hypertension, also known as essential hypertension, accounts for most cases. It has no clear cause and is often related to genetics, aging, and lifestyle factors. Treatment is usually long-term, sometimes lifelong, to maintain stable blood pressure and prevent complications like stroke and heart attack. Patients should follow medical prescriptions, adopt a healthy diet low in salt, exercise regularly, and manage stress effectively. Secondary hypertension occurs due to underlying medical conditions such as renal artery stenosis, hormonal disorders, or cardiovascular diseases. If diagnosed early and treated correctly, it can be cured. For example, some cases of renal artery stenosis can be treated with surgery or stent placement, restoring normal blood pressure without long-term medication. Regardless of the type, regular blood pressure monitoring is crucial. If you are at risk, seek medical advice and checkups promptly. Tips for effective blood pressure control. High blood pressure is a common health issue that can lead to complications such as stroke, heart failure, and kidney damage if not well managed. Here are essential tips to help maintain stable blood pressure and protect cardiovascular health. Regularly monitor blood pressure at home. Measuring blood pressure consistently helps track your health status and detect early warning signs. Use a home blood pressure monitor and record daily readings for reference. If blood pressure remains high, consult a doctor for proper treatment. Maintain a healthy lifestyle and reduce stress. A well-balanced diet with less salt, more vegetables, and fresh fruits while avoiding processed foods helps control blood pressure. Regular exercise, adequate sleep, and stress management are crucial in reducing hypertension risks. Activities like meditation, yoga, walking, or listening to relaxing music can help manage stress better. Seek medical advice when at risk. If you experience persistent headaches, dizziness, fatigue, or have a family history of hypertension, visit a healthcare facility for early diagnosis. Timely detection and treatment improve blood pressure control and prevent complications. Taking care of cardiovascular health not only enhances well-being, but also extends life expectancy. Act today to protect yourself and your loved ones. Blood pressure control. Protect your health. High blood pressure is a silent killer that can cause serious complications like stroke, heart failure, and kidney disease. Managing blood pressure effectively ensures a healthier life and safeguards loved ones from health risks. Did you know? Blood pressure below 120/80 mmHg is considered normal. Blood pressure above 140/90 mmHg may indicate hypertension and requires monitoring. Hypertension is manageable with early detection and proper treatment. Take action today. Monitor blood pressure regularly to stay informed about your health. Follow a healthy diet, reduce salt intake, and exercise regularly. Seek medical advice immediately if you notice abnormal signs. Don't forget, share this valuable information with your loved ones to promote heart health together. Health is the most precious asset. Start taking care of it today.